This morning we are joined by Dr. Cedarquist, who has some information about the most common type of eating disorder. She practices preventative medicine and weight management in Naples. Now, doctor, what is the most common type of eating disorder?
Well, when most people think about eating disorders, what they think about is anorexia nervosa, which is an eating disorder where people stop eating, restrict their calories, and get very, very underweight, or what's called bulimia, where people would eat a large amount and then purge that food afterwards. But indeed, the most common eating disorder is binge eating disorder. A recent study out of Harvard showed that 3.5% of women and 2% of men meet the criteria for binge eating disorder.
So how can you tell if you are a binge eater and have that disorder?
Well, sometimes people think, well, if I eat a lot, that means I'm binging and then I have binge eating disorder. But a lot of us eat more than we should at times, almost all of us do, and many people eat more than they should many times, but that doesn't make binge eating. What binge eating disorder means is that multiple times through the week, a person may eat a larger quantity of food than normal. Sometimes that's associated with eating it much more quickly than normal. But what's the most important thing is there's a feeling that you're out of control with the eating, that you do not want to do this eating, but you do it anyway. You're compelled to do it. And often it's associated with disgust or shame. People will report that they eat and they're not hungry. They're not doing it because it's fun or it's pleasurable. They really dislike the fact that they feel they have to do this.
Where do you believe that this comes from? What leads to this behavior?
It's actually not clear what is the cause of binge eating disorder. What has been found is a large percentage of people with binge eating disorder indeed have depression, but it's not clear if the depression causes the binge eating disorder or if having the binge eating disorder leads to the depression. It's not clear. It's also not entirely clear what the role of dieting is. It's kind of controversial. Many people will report that they remember binging years before they ever tried to control their weight. But many people do report when they try to go on a weight loss diet and they try to cut back on their calories, it aggravates their binge eating. They feel that they're more compelled to binge when they're actually trying to diet.
And restrict all that food, and then you become so hungry. Now, what are ways that they can treat this? Are there common ways to help people?
Yes. One of the things that's so important to understand is binge eating disorder is probably the most treatable eating disorder in addition to being the most common, but it involves a multidisciplinary approach. Usually you need a structured nutritional program because people can't stop eating. They need to become comfortable with it and not afraid to eat foods, but feel which foods are safe and which foods may not trigger binging. Another important part is to go into some sort of therapy where people look at their eating habits, the way they eat, and their feelings around it and try to change that. So if I'm feeling anxious or nervous and my tendency is to go to eating something crunchy and do this to excess, to change, okay, I'm feeling anxious and nervous. What do I need to do? What do I need to adjust? Can I exercise? Can I do other things? Sometimes the binge eating is triggered by conflicts within families, spouses, and sometimes fixing those issues help.